How quickly can I regain consciousness after K-19? Please share this video with your relatives and close ones, especially those who have lost their sense of smell after K-19. The reduction or loss of smell after a new coronavirus infection occurs for two reasons. Firstly, there is swelling of the mucous membrane in the upper parts of the nose where the olfactory analyzer is located, and this leads to the fact that the nerve cells give up and work worse. The second reason is the direct viral infection of the olfactory nerve itself, which also leads to the fact that the sense of smell is either reduced or completely absent. Based on these reasons, there are two directions in which we should act to reduce the impairment of smell after COVID. The first is to reduce the swelling of the mucous membrane, and the second is to improve the work of the olfactory nerve itself. How to determine whether the swelling of the mucous membrane persists after a coronavirus infection or not, we navigate by. If the swelling of the mucous membrane persists, especially in the upper parts of the nose, it manifests as stuffiness, heaviness, so-called. This manifests as a blocked nose. There may be a feeling of spreading in the area of the bridge of the nose. There may be a feeling of pressure in the area of the cheeks, behind the cheekbones. This can manifest as a feeling of flow from the nose to the throat. All these symptoms are indications to visit an ear, nose, and throat and actually determine whether the swelling persists or not. We usually treat such swelling with topical local intranasal steroids, which help to quickly and effectively reduce this indirect swelling. But we prescribe these drugs, which are based on mometasone, fluticasone, usually prescribed by a doctor. The schemes are individual. The schemes are different. There are contraindications. So in order to use these drugs, it is better to consult a doctor. Of course, it is significantly more difficult with the restoration of receptors, because we know that nerves practically do not recover. But there are also three directions to restore your olfactory function faster. The first is the moisturizing of the mucous membrane, improving its work so that it is better and more comfortable for the olfactory nerve itself. The second is improving the work of the entire central nervous system. And the third is olfactory training as a tool for faster recovery of the olfactory analyzer. How can we improve the work of the mucous membrane? And in fact, this is the simplest moment. To improve its work, it just needs to be moisturized. For this, we will take care to ensure that the temperature at home is not more than 24 degrees Celsius and the humidity is 50–60%. Plus, we moisturize the mucous membrane. Alternatively, a 0.9% sodium chloride solution available at pharmacies can be poured into a spray bottle and sprayed into the nose. Or use preparations with seawater, but isotonic, not hypertonic in any case, and isotonic ones which correspond in concentration to the physiological solution. We use these preparations 2, 3, 4 times a day. Whether you need to moisturize more depends on if your nose feels dry. If not, moisturizing morning and evening should suffice. If you feel dryness, you can do this more often. We also sometimes prescribe oils for moisturizing the mucous membrane, which can individually improve its function. Usually these are oils like sea buckthorn, or there is a complex oil on herbs. Caraveve's balm, Vitan, excellently softens the mucous membrane. But for the use of these oils, there is usually a contraindication. It is an allergy to flowering, an allergy to grasses. Therefore, if you are allergic, it is better not to use these oils. To improve the functioning of the central nervous system, we prescribe B vitamins, which contribute to the improvement of both the central nervous system and its peripheral departments. These are vitamins B1, B6, B12. As a rule, we prescribe complex preparations that contain all these vitamins. The course of treatment is usually prescribed from 10 days to 3 weeks. There is an excellent tool to quickly restore the sense of smell, and it is called olfactory training. To conduct olfactory training at home, you need to purchase 4 aromatic oils with flavors that you like. These can be floral scents, most often rose and lavender. It can be the aroma of coffee. It can be the aroma of oranges. That is, you choose 4 aromas. And here are 2 very important principles. The first is that you should like this aroma, and the second principle is that you should remember the notes of this aroma well. You should remember it as if you had just smelled it 2 minutes ago. And then it will work. What else do we need? We will need airtight jars. If you don't have small convenient jars at home, you can buy a urine container that seals airtight, plastic, convenient. And we will need cotton discs, which are likely to be found in every home. What we do is take the essential oil directly, drip a few drops onto the cotton disc, and put this disc into the container. We label it with a marker, label this scent, and we do this with all 4 essential oils, 4 containers. What do we do next? We proceed directly to the aroma training, to the olfactory training itself. We bring the container to your nose and start inhaling. While doing this, you try to remember this aroma, try to capture it and feel it. You take breaths for 20 to 30 seconds, then you rest for half a minute. Take the next aroma, and again for 30 seconds you take breaths and remember this aroma. You do all this with all 4 containers with 4 aromas. How often should you do olfactory training? I recommend doing this 2, 3, 4 times a day, as much as your time allows. The more often you do this, the faster your olfactory analyzer will recover. Take care of yourself well. I wish you good health. I hope everything is clear to you. If you have any questions, write them in the comments. See you. Bye.